I think my single biggest achievement is when rough sleeping figures are quoted on the TV, which they are frequently, and they say X number of rough sleepers, of which X% were women. That was me. That was one thing I did. Make sure that people could count that women and men are different when they sleep on the street. There are different needs and so on, and it was important to count them. But anyway, that's a different talk on a different day. Thank you for inviting me, and I chose the topic of the role of the private sector in addressing health and homelessness, or as I would prefer to say, the responsibility of the private sector in addressing health and homelessness. So, as Andrew said, homelessness makes you sick, and poverty makes you homeless. And homelessness in every one of its forms, from rough sleeping to the numbers in supported accommodation to people housed in temporary accommodation, is increasing in every part of this country year on year. Rich people don't sleep on the street. They don't sleep in a hostel, and they don't hold assured short-hold tenancies on universal credit rates of support for rent, unless it's a TV reality show, which does happen fairly frequently. Homelessness is a symptom of poverty, it's not a lifestyle choice. 136,000 young people in England approached their local authority last year for help with homelessness. 136,000, that's a homegrown problem. Only 22,000 people crossed the channel in small boats. But what was the headline last year? It wasn't 136,000 young people asking for help because of homelessness. Even within my own sector of charities working with young people who are homeless, the scale of mental health crisis is crippling people's ability to work, to learn, to compete for jobs, to live their best lives at the very age that they should be living them. Speaking to my own colleagues in the office today who work with young care leavers in South London, they were telling me that without fail, those 18-year-olds are shipped off for 2 years out of borough because there is nowhere to place them. Care leavers. These are the most vulnerable people in our society, and what little they have, they are uprooted from and out of borough for 2 years because that's the only place we can find private rented sector accommodation for them in order to house them until the local authority makes the decision on what their right and their duty is and can bring them back to live back in borough. God help them. They have nothing. They are the most disadvantaged in society, and they know this is a temporary measure, so they can't even settle in their new place. We set the most vulnerable up to fail. The current homelessness problem is of epic proportion, and in my 30-odd years, it's never been this bad, I'm sorry to tell you. So please be under no illusion, the bulk of homelessness is homegrown in this country, and the social cost is more than the actual cost. If we want to talk costs across London alone, this month, local authorities will be spending £90 million on housing people in temporary accommodation. That is a blistering, and I've done the sum for you, £1,080 million this year, £1,080 million just on temporary accommodation. That is not people living in supported accommodation, that is not people living on the street, that's just the people living in temporary accommodation. The cost of temporary accommodation alone is causing local authorities to declare steps towards bankruptcy, and they're citing this as the problem, and it has risen 40% on last year. Believe me, this problem is getting worse week on week, and if you sense urgency within me, it's because it is an urgent problem, because week on week the problem is rising. It completely kicks into touch the amount of money awarded to build new social homes, the cost of temporary accommodation. And whether that money is going to private landlords of family homes or the landlords of the appalling 1970s office block conversion where my local authority is housing mums and babies on an industrial estate, that any industry receiving over £1 billion of public money in a single year from taxpayers, possibly like me and you, we surely have a right to know that that money is being well spent, and those who are housed should surely have a right to some decent housing. So what's the scale of the problem? At the end of 2023, the big issue said 112,000 households were in temporary accommodation, including 147,000 children. 317,000 were supported to prevent or relieve homelessness. So that's not just people in temporary accommodation, that's a whole other group of people. And today in London, if you go and look at the news tonight, you'll see that we have recorded over 11,000 people sleeping rough on the streets of London last year, which is the highest ever recorded. And within that, the record number shows the highest level of increase amongst those who are new to the street. So those who have not ever been recorded on the street before. Those who are new to sleeping on the street are the biggest single group within those rough sleepers, and it's growing. 40% of those came to the street from stable accommodation. So here's a thought. Couldn't it have been prevented? That they were in housing, they were in stable accommodation, and they lost it, they were asked to leave for whatever reason. Could we not have prevented that in the first place instead of dealing with the symptom? So what is the responsibility of the PRS in this? In terms of PRS provision, and I think we all find different numbers, but I think we're roughly matching. I've settled on around 26% of households in this country are living in PRS, which makes it, aside from home ownership, which is around 50%, realistically the only gig in town to provide volume access to property. It has to be part of the solution whether we like it or not. PRS is also, as you said, the single biggest driver of homelessness. It's the single biggest driver. It's the single biggest reason people rock up and ask for help, because they're being evicted from PRS. And they're being evicted because of poverty, because of the years that the benefits were capped, because even when local housing allowance was increased finally this year after 4 years of being frozen by 8.1%, private rents went up by 8.7%. You know, they just put up the rents higher than the increase in PRS, in the local housing allowance. Wages haven't kept up with inflation, the cost of living crisis, leading to an inability to pay high rents, no-fault evictions, semi-legal evictions, and ultimately abandonment from poor quality accommodation. We know all of this, but I'm just giving you a sense of the scale and the urgency that we need to act. Personally, if it were up to me, I'm all over regulation. I would love regulation of the private rented sector. I'm all for licensing, but I know that it will take significant resource on both sides of the fence, for the landlords who would want to adhere to it and for the local authorities who would have to manage it. I don't buy the arguments that if we increase in regulation and licensing, all the landlords will sell up and there'll be no PRS left for us to use. I don't buy that. Property makes money over time. Eggs is eggs. It does. People will still invest in it. However, we have to be careful not to throw the baby out with the bathwater. In most cases around the country, PRS can work quite well. Decent landlords, decent properties, proud tenants, paying their rent. We don't want to upset that. We have to chunk this up. We've got a major problem around families in temporary accommodation. That's the problem we're trying to solve together, not throw the PRS sector out with the bathwater. In some areas where supply falls short of demand, there is incentive to churn through tenants, such as a golden hello. Quick browse of the internet yesterday showed values of between £4,000 to £6,000 for landlords to take a person or a household off their local authority homelessness list. If that person is evicted a year later for whatever reason, no fault eviction, whatever, the landlord takes another person from the list and gets another golden hello. And a year later, they get another golden hello. So I've thought the current system is incentivising churn, not stability in housing. So my thought is to stop for a moment. And in this case of PRS, how we bring those temporary households down, start thinking less of the homelessness and more about the housed, less about the symptom and more about the cause. What can we do to prevent the homelessness of those housed? Not at a point of crisis, but at the point of taking the tenancy up. How can we support landlords and incentivise them to retain tenants rather than incentivise churn and turnover? Do we offer more significant payments at 3 years? At 5 years of having one household in one tenancy? Hey, why not let the children see through school instead of making them leave year in, year out, another address? Let communities, instead of dealing with a constant stream of mattresses and chairs and broken whatever being chucked out at the end of one tenancy, let communities learn who their neighbours are, learn to get on with them, not have to deal with the detritus that comes with churning through private rented sector tenancies. To get to the point, I propose that the 80 million of the 1 billion and 80 million that's going to be spent in London this year is used on prevention programmes to prevent the problem from getting worse. Real mediation support between tenants and landlords from the start of a tenancy. Incentives to retain, not to churn. Slow down the wave of people moving into temporary accommodation in order to try and work with those who are already there. Catch up and keep up. I don't want to pour money into private landlords' pockets. I would much rather have that money spent on social housing in perpetuity for people who are homeless and need it in the future. But at the moment, and this week and this year, it's the only gig in town to deal at scale with the growing problem we have. And we must start from where we are at, to quote Vincent de Paul. There we go.